UDA. Is it possible? I'll be having that conversation at the top of the hour. Now, in 3 days' time, patients in need of the antiretroviral drugs will have their supply line restored after the Kenya Medical Supplies Authority KEMSA dispatched the April ARVs consignment to hospitals across the country. This move is meant to stabilize the situation in all the 47 counties, weeks after Kenya began experiencing an acute shortage of the ARVs, a shortage that greatly affected persons living with HIV and AIDS. Willie Lusige with our update.
Kenya has been experiencing a serious shortage of drugs meant to contain the HIV and AIDS virus. The antiretrovirals drug have been stuck at the port of Mombasa since January because the donors, USAID, refused to distribute the drugs after the government demanded to be paid taxes worth 90 million shillings. Days after the government waived the tax demands, Kenya Medical Supplies Authority KEMSA despite the April consignment.
We are assuring the nation that no patient is going to miss drugs. We have adequate stocks for those patients.
The batch comprises of ARVs kept by KEMSA and will be used in the month of April across the country.
These are the supplies which have been with us, the old stock which belongs to PEFA and Global Fund.
Patients will be able to access their medication in all the public facilities, and already KEMSA has dispatched drugs for 31 counties, and the remaining 16 will receive their consignment within 3 days.
Probably in the next couple of days, a maximum of 5, all facilities in this country will have the medication they need.
The other consignment donated by USAID that was stuck at the port of Mombasa since January is on the way to KEMSA after the government did away with the tax demands from the donor.
Most of you will be aware of the consignment which has just been released. We are expecting that consignment anytime from now, and once it comes, we shall distribute it the normal way we do.
Although that's now resolved, the 1.4 million Kenyan living with HIV have been struggling to access these drugs, their lifeline.
So we supply monthly to the facilities, and we expect these facilities to have at any time 2 months of stocks.
Willie Lusige, KTN News.
Now, gender-based violence cases recorded between the month of January and June 2020 increased by